Hello and good morning, everyone. Welcome to the What's Up Wednesday Get Inspired Health and Medicine Resources webinar. My name is George Bergstrom, and I'm the Southwest Regional Coordinator for the Indiana State Library's Professional Development Office. I'll be presenting today. I'd like to start off the webinar with a few announcements. To register for other webinars or other trainings available from the Professional Development Office, please see the Indiana State Library's events calendar, which can be found on our website at www.in.gov/library. This session is 1 hour, so you'll get 1 TLEU for today. If you are watching an archived recording of this webinar, the instructions on how to obtain your TLEU are available in the video's description on YouTube. You can also find those instructions on the Indiana State Library's continuing education site under the LEU policies. All right, let me go ahead and bring the presentation up. Can everyone see that? Let me know in the chat. Yes, awesome. Okay, so today we're going to be kind of focusing on a few of the databases in Inspire that can be useful for health and medicine resources. So first, I'm going to kind of do an overview of some of the databases you might want to pay attention to in Inspire. Then we will go over some of the resources that can help with searching. Then we'll probably spend the bulk of our time doing some sample searches. Most of that, of course, will be focused on your questions. And again, if you do have questions or need me to slow down or anything like that, just go ahead and drop that in the chat for me. So the first set of databases I want to talk about are some of the databases that might be more appropriate for helping people with individual health or medicine research type needs, or sometimes thought of as consumer health type resources. And the three that are probably the most useful for that in Inspire are Alt Health Watch. And this, as we see here, this database focuses on many perspectives, complementary, holistic, and integrated approaches to healthcare and wellness. The second is Consumer Health Complete. This database is a comprehensive resource for consumer-oriented health content designed to support patients' information needs and foster overall understanding of health-related topics. And so not only is it a great database, but also, as we can see here, that one also offers multilingual interfaces available. And probably the third that I would use for consumer type questions is Health Source Consumer Edition. And this database provides information on many health topics, including the medical sciences, food sciences and nutrition, childcare, sports medicine, and general health. So for these, I would kind of relate them to, it's been a long time since I've been at a public library reference desk, but these are the ones I would have most often gone to for general health questions or medicine-related questions in a public library setting. But obviously, you also can get questions that are more academic focused, whether it's high school students, college students, or just adults who are interested in a slightly more academic approach to the health sciences. And so for those types of questions, I would probably turn to one of these three databases. The first, Biomedical Reference Collection, is designed for doctors, research scientists, students, and clinical specialists, providing access to over 100 journals in a variety of areas of medical study. Probably the one I would go to first, of course, would be Health Source Nursing/Academic. This database provides scholarly full-text journals focusing on many medical disciplines. It also contains the AHFS consumer medication information. So the stuff on drugs and generic drug patient education sheets, that's one of the really valuable tools in that source. And then, of course, if it's anything related to psychiatry, psychology, or the like, I would probably use Psychology and Behavioral Sciences Collection. Comprehensive database covering information concerning topics in emotional and behavioral characteristics, psychiatry, psychology, and mental processes, etc. So if you're using one of these resources and either yourself or a patron has issues with searching them, here are a couple of places you might want to turn. Obviously, you can start with our archived webinars. We do have several on the continuing education page that relate to just general searching in Inspire and the various Inspire tools. So those are a great place to start. Obviously, today's webinar will be there within a week or two, so you can always refer back to what we talked about today. But as a reminder, EBSCO has a lot of tutorials as well. They have many just on basic searching, but they also have several that are specifically targeted to single database usage. So the URL is here, and this slide deck will be on the archive webinar page after today's webinar, so you can always grab that URL from there. Or you can just search Google or whatever for EBSCO tutorials, and you should be able to find this page. And the last thing you might want to think about, especially if you have a researcher or a member of the public who's really getting in depth in a single database, is you may want to direct them to YouTube. I would tend to search for the name of the database and probably, academic or tutorial or something like that to sort of narrow in on it. But many colleges and universities create their own tutorials and how-to videos and put them up on YouTube. I know when I worked in academics, we did that a lot. And you can get focused videos on a single search tool that might go into more detail that you want to point your customers to. And if you're doing this for yourself, the only thing I would caution you about those is that unless you get pre-approval from the state, those would not earn you any TLEUs. So if you're looking for that, I'd stick with our resources. But if you just need like a 5-minute, super focused how-to on one particular aspect, I would probably turn to that. Okay, are there any questions about the list of databases or maybe where to go after today if you need help with searching before I move forward? Okay. Since I see nothing, we'll go ahead and jump into Inspire. Okay. So from here, hopefully everyone is comfortable, but I'll just kind of point out a couple of things. If you click research or search by subject, you're going to get very, very close to the same thing. I'll kind of show you research first. And you get a couple of things up at the top, which for today we wouldn't be interested in. And then kind of where this invisible line is, everything from there down is pretty much the same if you had clicked on that subject list. And so you can see we do have a subject focused in on health and medicine. And many of the databases I mentioned are there, but there's going to be a lot of others that for the most part are not going to be the ones that I would start with. Kind of a big example here are the various interfaces of Medline. I probably wouldn't go to those unless it was a very, very academic focused research request. And Green File, again, is also very, very focused on a couple of pretty niche aspects of health and medicine. But of course, since we have the names of the 6 we're interested in, we could also just go A to Z. So we'll kind of start in Alt Health Watch. And at this point, we're in pretty much the basic interface for most of Inspire databases. So if you're comfortable with this, or the person you're helping is already comfortable with this, you can probably feel comfortable turning them loose. But if, for example, I were to search for something and I didn't take their advice and I just did my single keyword, obviously you're going to get a pretty wide range of results depending on which database you're in. So if we kind of note this down just for comparison purposes, 6544 in Alt Health Watch. And if we look at this, we're probably going to see these are not necessarily sources and or information that's going to lead us to learn about what diabetes is, although there's probably a little bit in here, but it's more going to focus on things that might help us treat or supplement ways to deal with whatever the keyword is we searched on. So obviously diets and how they play with diabetes, pharmacological, so non-pharmacy ways to deal with gestational diabetes. So you kind of see that skew towards the alternate health side of things. And then as a reminder, of course, and you'll get this in several of other webinars if you want more details, but because this is a fairly standard Inspire/EBSCO search interface, we can do things like limit by date. We could just limit to full text. We could look at our sources here. And of course, lots of other ways to filter: language, publisher, topic, etc. Another thing I'll point out, which hopefully everyone is aware of, once I'm already inside this interface, I don't have to go all the way back to the Inspire main page. I could then pick a different database. So I could jump right to that consumer health. And of course, I could search both by leaving both boxes checked. I'm not going to do that for today, but it is something to be aware of. And of course, this looks nearly identical. In fact, the only way we can really tell is that now it tells us we're searching Consumer Health Complete instead of Alt Health Watch. So again, if I were to do a single keyword search, notice that we've got significantly more results, almost a little more than 7 times the results. And if we kind of scan through these, we'll see that instead of being from a perspective of management, we're going to be a little bit more, slightly more skewed towards the medical side. Although we do have some repeats. I believe this one was in Alt Health Watch as well. But nursing interventions, physical activity and how it impacts. Although some of these look similar, so management with low fat and whole foods. So you can see kind of just from the single word search and both the difference in results and the types of results we're getting, how you might want to use each one, especially if you're targeting it towards the question that your patron may have asked you. All right. And then, oops, yeah, sorry, health source consumer. And even kept the keyword for me. How nice. So now we're sort of in between the first two in terms of results. 73.92. And it definitely feels like these are a little bit more introductory. So deciphering diabetes. Why movement is important. 5 myths. Are there any questions about sort of the ins and outs of these 3 and how they look different? Not yet. Okay. Oops, let's cancel that. So now, let me go back and remind ourselves, if we're looking at more of the academic side of things, biomedical, nursing, academic, or psychology. Oops. Still very similar interface. Hopefully everyone's aware of that, but almost all of EBSCO databases have this. And I think that's a benefit, that they all look and feel the same. And if we were again to do a single keyword, we're going to get a fairly large result set. But we can start to see, just as we look at the first couple, that these feel much different. So the co-administration of viscous fiber, and then some words that I don't know, chai and ginseng, early microvascular complications. So you can see already that we've really sort of stepped up the type of resource we're getting here into a much more academic focus. So if you did have students or someone who is really into the academic side of some sort of health topic, you might want to start with one of these. Okay. We looked at health source consumer, but now we're going to look at health source nursing. And so now we really see from that result is over 123,000. So just kind of as a quick comparison, health source consumer gave us about 44,000. So this is almost triple the results. But you definitely start to see repeats. So depending on the type of patron, the type of question, really can impact where you might want to start. So that one, again, more academic, definitely academic. GLP-1 receptor. And again, all the same filtration options are over here. Now, the one that's going to be the most different is this one, psychology and behavioral sciences. Oh, and it didn't break my search. That's good. So here we definitely see, again, maybe switching in tone, changes in patient self-management. So kind of the link there, snoring and diabetes. Supporters, so kind of, support networks and things like that. So we've got a lot of options here. And one of the first things, obviously, reference interview, kind of keying in on what type of resource is the best for the question at hand. Are there any other questions or examples that you all want me to use as we try to determine which might be the best database for your situation? Or does anyone have any questions about the sort of filtration and advanced features that I've not gone over yet? Karen asks, are there specific sources you would use for a public health topic? So if we look back at the overall list, and I guess it would also depend on what aspect, I mean, what specific in your mind makes it public health. So are you thinking obviously like what we're dealing with now, COVID, et cetera, and the effects on public health, or are you more interested in because it might also depend on the level of the patron question. So for example, if we were interested in, I mean, we might as well use COVID since we're all living through it. If it's just, okay, community person researching public health programs. Okay. So I would probably kind of take a two-tiered approach on that. You might want to dip just a little bit into the academic side of things, depending on exactly what they need. So if they do need slightly more harder data or examples of how something like that might work, you probably would need one of the more academic related databases. So just based on our results lists from that very basic search we just did, health source nursing/academic may have the widest breadth. But you could, and then of course, if they need an aspect of that, benefits, etc., on not just health outcomes, you would probably find some stuff in psychology and behavioral sciences. So again, the likelihood of a needle exchange impacting the behavior of the people who would use the service, you might find in psych and behavioral sciences. You know, the actual health benefits, you might find more of that in nursing academic or nursing/academic. But if there's also the aspect of presenting that information to a set of people who are less health focused, so again, if they're having to make this presentation to the public, you might also want to lean on some of the other more consumer focused databases. So for example, if we start, whoops, not that one. Go back to the AZ list. Oops. So we've got under 150 in health source consumer that might help present the information again to a more, or to a less science and health-based audience, but you would probably want to supplement that with things from the more academic side. Yeah, you've more than tripled your resources. And so here you've got a little bit more focus. So if it was, again, in a prison, you've got several here that look like they would help. Rural United States. So yeah, I mean, it's going to depend a little bit on the person doing the research and their comfort with reading. And that's another thing that you or they will want to look at is, you know, the reading level of some of these resources, because obviously in the more academic focused databases, you're going to get language that is a little bit more academic focused. And if they're comfortable with that, then they're going to find some really good information there. And if they're comfortable with digesting that and translating it, then they could probably stick with that to whoever they're presenting the information to. But if they're not, they might want to use one or more of the consumer-focused databases. And this can get tricky, but another thing that I did mention quickly is, remember, you can always search across multiple databases. So they could have the consumer database picked, and they could have the academic database picked, and they could have psychology and behavioral sciences picked. And now they're searching across all three. The advantage, obviously, is you only do the search once. The potential downside is that your results list is going to be much bigger. And I have never been comforted. When you search across multiple databases, you lose a little bit of the nuance, and so you might miss some results. It's not like it just adds the 3 result lists together. But let's see what happens. Yep, 1,200. So we definitely lost a few, but we should get a good mix here. And then, of course, you know, I'm assuming they're going to want stuff that's not 20 years old. And they probably only want things that are full text. And now you're down to a little under 300. So should be a good place to start. And I'm sure there's a way to filter out international if you didn't want things from other countries, although that might be useful to get stuff from other countries. So. Any other questions? That was a really good one. Are results lost, or just because the article? Well, it's partially that, yeah, they're appearing in more than one source, but it's possible now. It's happening less and less because right now everything in Inspire is EBSCO. But when there were things in Inspire that were EBSCO and Gale and possibly other sources, then you sometimes could lose things when it was a federated search because not each database vendor used things the same way. So it's less of an issue now. But depending on the amount of time I have, if I'm doing it for my personal research, I sometimes just do it individually across multiple databases instead of all in one search. But for 95% of what we're doing to help people in most library settings, showing them how to do it across a single search is probably better. Your mileage may vary, of course. Are there other questions? All right. Well, I'm going to come back to Inspire's main page, kind of go over a couple of reminders, and then we'll go back into the presentation slides. And if there are no other questions, we can kind of start wrapping up. So as a reminder, when you first get into Inspire, you could do research or you could do by subject. And either way, you're going to eventually find this list. And these are all great, but A, they're not every database, and B, there's a lot here that I would only use in very, very specific circumstances. So that's kind of why I focused on the 6 databases I focused on today. So for things for a more consumer or everyday kind of medical standpoint, we kind of looked at Alt Health Watch, Health Source Consumer, and oh, it's not even listing the other one here. And Consumer Health Complete. Oh, it was there. Okay, cool. And then if it's more academic, we had Biomedical Reference Collection Basic, Health Source Nursing or Academic Edition, and then of course Psychology and Behavioral Sciences. So you can either find those either under research or by subject, or of course A to Z. And then the other thing to remember is that once you're in any one of those, you can add more databases to search across platforms. And the dog is going crazy. I apologize for that if anyone can hear it. Also, kind of remember that if you yourself need refreshers on basic searching, there are resources on the State Library's Continuing Ed page or EBSCO tutorials. And if you need a specific tutorial on any one individual database, if it's not in EBSCO, I recommend checking out YouTube. There's my contact information. And I'm going to grab the link for the, whoops. Copy the link, drop that in the chat for the LEU. And if you all want to type questions in, I'm going to find out what the dog is going crazy about, and I will be right back. If you think you're okay, you can fill out that form and have a great day, but I will come right back to answer any more questions for anyone who has them. I apologize. Okay, sorry about that. Any suggestions for community health data? Listening websites will be more current than database publications. Yeah, I mean, you could check. Now, that is one case where you might actually want to use Medline. I'm not a huge fan of Medline because the search interface is not great. It's a government tool, so of course, and it's very often not in full text, but it could get you citations to extremely current research. But other than that, yeah, the websites of, you know, local health officials, state, of course, health sites, stuff like that, would probably be a little bit more up to date. Now, if you need stuff on sort of community health data, you know, across communities or comparing, you might find some good stuff in one of those more academic databases. So Health Source Nursing/academic. Yeah. I mean, some people just get better at, I mean, Medline, it is a wonderful resource in terms of what's in it. Medline Plus, much lower reading level. Oh, interesting. So there you go. Any other questions? All right. Well, yeah, we'll go ahead and stop the recording. I will stick around for a couple more minutes in case there are more questions. Please remember to use that link